The death toll from coronavirus continues to rise in China, bringing the total number to almost 1,400. More than 60,000 have been infected. The largest single outbreak outside China is on a cruise ship docked in Japan, where 218 people are infected. More than 3,500 passengers are being held in quarantine on board the Diamond Princess. Today, some of them have been allowed to leave, as Rupert Wingfield-Hayes reports.
For 10 days now, the giant Diamond Princess has been tied up at Yokohama. Its 3,700 passengers shut in their cabins, allowed out to exercise only once every 2 days. Today they finally got some good news. No new infections for the last 24 hours. And this afternoon, this bus began taking some of the most elderly and frail passengers off the boat to be quarantined elsewhere. The Japanese authorities are now finally allowing some people from the Diamond Princess to disembark. Those over the age of 80 and with underlying health conditions are being given the choice to be quarantined elsewhere. But there are still many questions about how the Japanese government has handled the outbreak on board this ship, not the least of which is why have they still not tested everyone on board. From their cabin, Phil and Gay Corter from Florida tell me they are in good spirits. But they say they're extremely frustrated the Japanese government is taking so long to test everyone.
We absolutely should have been tested. The test results could have been back. The people who tested immediately and were clear should have been off the boat. Why couldn't we have all been tested? Why couldn't we be off the boat? Why couldn't we be home by now?
We're the second worst cluster after Wuhan, China in the world. And we have people here from every country. Doesn't that call for at least testing us?
Public health experts agree. They say the cramped conditions on board the Diamond Princess could be allowing the virus to continue spreading.
I don't think it's the best solution. For many people on the ship are infected as a result. If it's airborne infections, they might be infected via ventilation systems.
But Tokyo is about to host the Olympic Games, and Japan is determined the virus will not be allowed to get loose on shore. It may already be too late, though. Japan has now recorded its first death from the virus, and today 9 new infections, including a Tokyo taxi driver. All had no connection either to the Diamond Princess or to travel from China. Rupert Wingfield-Hayes, BBC News in Yokohama.
Well, here, health officials have contacted more than 200 people who were at a transport industry conference in London last week after it emerged that one of them has been diagnosed with coronavirus. 2 MPs who attended said they were well, but were cancelling public engagements as a precaution. So how concerned should we be about coronavirus in the UK? Fergus Walsh reports.
The new coronavirus has been described as public enemy number 1 by the head of the World Health Organization. But how much of a threat is COVID-19 locally as well as globally? The epidemic is still mostly limited to mainland China, over 63,000 cases. But those tracking the disease reckon the true total is at least 10 times that figure, because the vast majority have such a mild disease they don't need treatment. So out of probably hundreds of thousands of cases, there have been almost 1,400 deaths in mainland China. Elsewhere, there have been around 600 cases spread through another 24 countries. There have been just 3 deaths outside mainland China in Hong Kong, Japan and the Philippines. Cases with no link to China are concerning. Singapore has the most. Now, if the virus spreads out of control beyond China, that is when a global outbreak, a pandemic, would be inevitable. In the UK, nearly 3,000 people have been tested for coronavirus, and there are still just 9 positive. 1 has gone home and 8 are isolated in hospital. So how bad could it be if we get an epidemic of COVID-19 here? Well, there's still much we don't know about the virus. But if we look at seasonal flu, for which there is a vaccine, the annual number of deaths from flu complications has averaged 17,000 in England for the past 5 years. And it has a big impact on hospitals. Last year across the UK, more than 3,000 patients were admitted to intensive care as a result of flu. So for now, it is flu, not coronavirus, which poses by far the biggest threat here in Britain.